My name's Ben Wheeler. I'm from the European Centre for Environment and Human Health and the WHO Collaborating Centre in Natural Environments and Health here at the University of Exeter College of Medicine and Health. And today I'm going to talk through some of the key issues raised in a report we've produced for the World Health Organization European region on nature, biodiversity and health. And we've called it an overview of interconnections. And I'll get into what the kind of aim of this report is in a moment. So the report is set in the context of the internationally changing environment that we all exist within. So we know, and we've heard a lot in recent weeks around our changing climate, but we also know that globally we have significant loss of biodiversity, we have habitat fragmentation and loss. We have ecosystem failures at large scales, and also land use change and overexploitation and urbanization. So we have a really significant amount of environmental change going on globally, but we see this also reflected at national scales and local scales. As well as those changing environments, we also inhabit very changeable societies. We have rapid population growth, we have demographic change, especially with increases in our older populations. We have increasing population mobility, increasing demands for energy and resources. We also have changes in our patterns of consumption, changes in trade and tourism. So really substantial changes in how we live our lives, both individually and collectively. And thirdly, this connection between biodiversity and nature and health is also set within a context of significant inequality and injustice. And we see that in terms of our unequal exposure to environmental risks, which are really very well established, but also unequal distribution of or access to health promoting natural environments and resources. And really we have to see these connections between nature, biodiversity and health in terms of both the risks and the benefits to health that our exposure to natural environments can bring. So this whole report really is set in these contexts of really significant environmental change, social change, and substantial inequalities and injustices. And again, we see these playing out at scales from the local to the global. So what were the aims of this report? Well, this report provided an overview of the interconnections between natural environments and biodiversity and human health. So it really focuses on this wide variety of ways that nature and biodiversity and ecosystems and the natural world in general can support and protect health and well-being, but also how degradation of those natural systems and loss of biodiversity can really threaten human health. So bringing together these different ideas around these complex interconnections between natural environments and human health. So what are those interconnections and what might they be? Well, before we get into that, actually, it's really useful to think about the different kinds of frameworks that these relationships have been considered under. And these frameworks are kind of interconnecting, and in some ways they are just kind of different framings of the same problems and solutions and connections. But it's really worth thinking about these, I think. And in the report, we briefly get into sort of how these issues do get framed. So first of all, thinking about ecosystem services, many of you will be familiar with these ideas around ecosystem services, that we have these, in this case, the four primary domains of services, such as supporting services, which are the sort of underpinning ecosystem services that allow all of the other services to be delivered. And that includes the really fundamental things like primary biomass production, water cycling, soil formation, and so on. And those supporting services underpin provisioning services, so things like provision of wood and fibre and fresh water, regulating services, particularly like climate regulation or pollination, natural hazard regulation. And cultural services, perhaps the aesthetic value and inspiration by nature, recreational opportunities of being in nature, mental health promotion and social contact. So a really diverse range of ways in which ecosystems may be providing services to human beings. And we can really see that, it's very clear that all of these services can have potentially really substantial impacts on human health and well-being. So a really clear direct linkage between the provision of ecosystem services and human health outcomes. Another framework that's come to the fore fairly recently really is planetary health. And this has been defined as the health of human civilization and the natural systems on which it depends. So a slightly different framing, but really covering a lot of the same kinds of ideas that we might think about with those ecosystem services, and especially ecosystem services that we can consider as directly resulting in human health impacts. And then thirdly, and this is a framework that's going to be considered later on in the conference, is One Health. And again, an idea and a framing that's been around for a little while now, but that's gained a lot of traction, really around the intersection between human, animal, and environmental health. So another kind of set of ideas that really link together human beings and our health, but particularly in this case with animal health and environmental health. And clearly these different frameworks kind of intersect and overlap, and sometimes it's a matter of kind of convention in some fields or in some settings. One framework might be more popular or more kind of gain more traction than another. And to my mind, that's fine. It shouldn't matter too much. These are really useful ways in which we can consolidate and consider the set of systems and relationships between those natural environments and human health and well-being. So that's our context. So how do we consider the different ways in which nature might be a vital support system for human health? And we consider kind of a bunch of different kind of domains really in how this works. So to take some examples from that, freshwater systems. So those freshwater systems really underpin the majority of ecosystem services. We're a very water-based kind of species, as are most, or if not all, species on the planet. And clearly making these connections with biodiversity, that biodiversity is really key for functioning freshwater systems. So we need the right kind of biodiversity for water purification, to support the atmospheric cycling of water, to be involved in erosion and sedimentation control. And so that availability of good water quality in turn supports biodiversity, which in turn supports all other ecosystem services. So we can really start to see these kind of complex systems weaving together, in this case, with this example of the kind of connecting links of fresh water systems. Moving on from water to air, we know that poor air quality is the #1 cause of premature death from environmental factors in the European region. And we know that nature, ecosystems and biodiversity can have that really pivotal role in how our local and global atmosphere is regulated. And a key example of this, and we've seen this cited quite a lot recently, lots of large-scale tree planting programs, is the potential for plants and trees especially to produce oxygen, store carbon, and especially to clean the atmospheric environment. So lots of work recently on how urban trees particularly may be a key part of helping to regulate and mitigate the air pollution that on the whole tends to be anthropogenic, and as it says here, is highly problematic in terms of the scale of its public health impact. Then moving on to how nature might contribute to our quality of life. I've sort of mentioned this briefly already, but our access to nature, to high quality green and blue spaces, to our beaches and our parks and our woodlands, that kind of access to nature we know is good for physical health and mental well-being. Really sort of a boom in the evidence and related policy in this area over the last 10 years or so. So we have good evidence that increased exposure to green space can be associated with better health and better well-being. And also that actually, not just in terms of living near nature, but visiting it, we have good evidence now that more frequent visits to natural environments can relate to better outcomes in terms of well-being, life satisfaction, happiness, but also more substantive, perhaps measurable health outcomes, particularly in terms of mental health and physical activity. So in this case, sort of trying to take the positive aspects of our natural environments and how good they can be for population health and well-being. Also thinking about things like soil. We know that soil is fundamental to a lot of nutrient cycling and to production of food, obviously, particularly for the human population. And that soil biodiversity and the biodiversity more generally within agricultural systems is a really key part of contributing to our food security and the provision of nutritious and healthy diets. And there's evidence now that biodiverse agriculture is actually more resilient to the external shocks and stresses of environmental change, including the impacts of climate change. And then lastly, in terms of these examples, the protection that nature provides. And we can think about in terms of biodiversity being a provider of pharmaceuticals and healthcare. We know that around a third of modern pharmaceuticals have actually been directly derived from compounds that are found in the natural world, and lots of other drugs are designed to mimic natural products. And we know, therefore, that if we're losing biodiversity, we're losing future opportunities to turn those kinds of, those sort of naturally occurring compounds into really valuable pharmaceuticals and other modes of healthcare provision that we might need in the future. And also failing to protect our nature can threaten health and well-being. So we know that zoonoses represent a major public health problem around the world, and we won't get into the ins and outs of where exactly the COVID-19 pandemic is coming from, but we know that there's plenty of other examples anyway of how when we disturb and disrupt ecosystems and we change how people behave and move within natural ecosystems, we can change our risks of human disease occurring. We change the geographical and temporal distribution of our exposure to existing pathogens, and we can increase the risk of the emergence of new infectious diseases. So that's a whistle stop through a few examples of the kinds of relationships that we might be thinking about when we're thinking about the relationships between nature, health and well-being. But the question then is, so what? So what do we do with this information, this understanding? Well, one of the things that we can do is to start to try to understand the economic value for health of nature and biodiversity. And we know that a lot of these services and benefits that nature provides are really frequently taken for granted. We often just assume that they are happening there in the background and that, you know, that they're just happening. But we know that we need to somehow value, whether that's through monetary valuation or through other modes of non-monetary valuation, to really understand and accept the value of nature in providing these kinds of services, that in order to ensure that we gain those health benefits and that we manage those environments sustainably into the future. Just diverting briefly to another report. So the Economics of Biodiversity, commissioned by the UK Treasury, and reporting last year, the Dasgupta review, considered the wide range of the economic values of nature. But I thought a really interesting outcome from that report was this statement: accounting values of natural capital do not adequately include the health benefits a less degraded nature confers on us. They're even further away from being able to include the benefits to our mental health that green spaces confer on us. So really saying that we really don't know very much at the moment about what these kinds of scales of health economic value of biodiversity and nature might really be. So what can we conclude from these kinds of understandings of relationships between nature, biodiversity and health? Well, There's a need for action. Clearly, we need to think about dimensions of nature in decision making across sectors, and really important to think about how this works across both health and environmental sectors and all the other kind of sectors of policy and business as well, in order to protect those natural environments as really sort of the fundamentals of our existence. And it's really a global challenge. It requires multi-sectoral action, and it requires these coordinated efforts across boundaries. And really it involves a development of our broader understandings and commitments from all the kinds of organisations and individuals that need to commit to being part of the solution rather than part of the problem. In terms of the kinds of actions that can actually be taken, we can look towards integrated policies and commitments across sectors, as I say, especially between the environment and health sectors. We can look at co-beneficial strategies and ways of working, so really understanding all the co-benefits that can arise across sectors from doing certain interventions, certain policies. We really need to develop our capacity and skills, and I would say this working in a university, but seeing that development of education, understanding data science as being really important. And we really need to support sustainable production and consumption using financial tools and interventions, and to understand and acknowledge critically what are the consequences of our inaction, what happens if we choose to do nothing. There are also really significant opportunities here, and we'll be hearing about some of these other opportunities during this conference. So what about sustainable planning, and especially thinking about planning in a One Health context? How do we plan our communities? How do we plan our environments in ways that are sustainable, both for humans and for our natural ecosystems that we are part of? How do we take all the challenges and the negative impacts of COVID and post-COVID times and the future pandemics and turn them on their head and create opportunities from those for our health and for our well-being and for the environment? And how do we look at nature-based solutions as a way to understand all the multiple economic benefits of doing things that are good for the environment and also good for us as human beings? So I'll leave it there. I'll just acknowledge the many contributors to this report that took place over the last 6 months to a year, and say thanks very much, and we'll look forward to taking your questions. Please do post them in the app as we go along. Thank you.